So just trying to bring together what both Doctors Brody and Sonu have talked about, we know that race is a social construct and not a condition, but the disparities that go along with race and racism are real. And so what we see in this time of COVID-19 is that the most disenfranchised communities, African American communities, Latinx communities, indigenous communities, are at highest risk to contract COVID and to die from COVID. When you look at some of the data from states across the nation, but particularly in the Southeast, where you see, for instance, I think even in Illinois, 30% of in Georgia, 30% of the population is African American, but some 70% of the deaths have been African Americans. And so this is a culmination of some of the disenfranchisement in communities. African Americans are more likely to be in those frontline essential jobs where there's limited PTO time. For children who we believe are less impacted by COVID, many of them are being cared for by elderly caregivers, grandparents, relatives who are high risk for COVID. So we see this convergence really of these generations really of health disparities that put African Americans and communities of color at highest risk to be affected by COVID. And so it's not surprising that we're seeing the sort of disparities that we're seeing at this point.